Right now, 18 million Kenyans have made a decision that could either save their lives or completely drain their bank accounts. And if you're earning more than 50,000 shillings a month, what I'm about to show you might make you very, very angry. Let me show you the math they don't want you to see. On October 1st, 2024, Kenya officially killed NHIF. After 58 years, a brand new system stepped into its place. SHA, the Social Health Authority. The government says it's better, more modern, more fair, and with 18 million people already registered, it's clear Kenyans are hoping for a miracle. But what I found after 2 weeks of research, comparing SHA to NHIF, and then comparing both to the best performing healthcare systems in the world is honestly shocking. Because in 2025, healthcare isn't just about hospitals and insurance cards anymore. It's about data, digital infrastructure, AI, senior care, chronic disease, and a country that must be ready for an aging population that's growing faster than its healthcare workforce. Kenya is not just building a healthcare insurance system, we're building a lifeline for the elderly, the vulnerable, the chronically ill, and we are doing it at the exact moment the world is going through the biggest healthcare transformation in history. So today I'll break down what SHA actually is, what you're paying, what you're getting, and whether the system is strong enough to support the future of Kenyan healthcare, especially for seniors. And stay to the end because I'll compare Kenya to Taiwan, the country with the #1 healthcare system on earth, where AI runs quietly in the background like oxygen. What they built will blow your mind. Let's begin. What exactly is SHA? Simple explanation. SHA is the institution, SHIF is the insurance. Think of SHA as the company and SHIF as the product. The big promise is this: universal healthcare, everyone covered. Formal sector, informal sector, rich, poor, everyone pays, everyone gets treated, and honestly, this is starting to feel a little reminiscent of something we've heard before, and you'll see exactly what I mean in a second. But before we roll that clip, let's talk about the one group that needs this system to work the most: Kenya's seniors. The senior care crisis in Kenya isn't being talked about. Kenya is aging quietly faster than most people realize. Our parents and grandparents are living longer, but with more chronic illnesses: hypertension, diabetes, arthritis, dementia, strokes. Families are exhausted, care homes are overwhelmed, caregivers are underpaid and understaffed. And the cost of care is pushing people into poverty. So universal healthcare isn't just a policy idea, it's survival. If SHA works, it could protect millions of elderly Kenyans from catastrophic medical costs. If it fails, the consequences will be brutal. But here's the catch: universal healthcare only works if the system behind it is strong. It needs digital infrastructure, clean data, fast processing, transparency, and AI powered oversight to prevent fraud and delays. Kenya does not have that infrastructure yet, which brings us back to that feeling of deja vu. Roll the clip.
If you like your doctor, you can keep your doctor under the reform proposals that we put forward. If you like your private health insurance plan, you can keep it.
Check this out. Under NHIF, the maximum contribution was 1,700 shillings, no matter how much you earned. With SHA, everything changes. You now pay 2.7% of your gross salary. If you earn 50,000 Kenya shillings, that's 1375. If you earn 100,000 Kenya shillings, that's 2750. 200,000, 5,500. 300,000, 8,250. That's 99,000 shillings a year before you even touch your money. If you want me to calculate your exact amount, drop your salary in the comments. Are you getting more? Yes, and also no. To be fair, SHA tries to fix real problems: broader coverage, more private facilities, better emergency response, focus on primary care, a plan to include informal workers. But here's the problem: SHA is brand new. NHIF ran for 58 years. SHA is a newborn being asked to sprint, and already we are seeing delayed hospital payments, registration errors, digital outages, facilities not integrated, patients being turned away. And do you know what could solve most of this? AI. The buzzword, the real thing. AI systems in healthcare around the world detect fraud, match patient data, predict resource shortages, streamline hospital claims, detect chronic disease decline early, support caregivers, reduce paperwork for nurses, improve senior care monitoring. Kenya does not have that backbone yet. We have digital enrollment, but not intelligent infrastructure, which means universal healthcare rests on a system that is not yet universal, not yet reliable, and not yet smart. SHA wants everyone, including boda boda riders, mama mbogas, gig workers, jua kali artisans, to contribute 2.75% of their income. But how do you calculate daily, inconsistent, untracked income? You need AI income modeling, the same tools used in Taiwan and Korea. Mobile money behavior, spending patterns, seasonal earnings, demographic data, geolocation movement, transaction clusters. Kenya hasn't integrated any of this yet, so the system is asking informal workers to pay without having the tools to calculate or collect those payments fairly. Let me show you something. Taiwan has the #1 healthcare system on earth, and here's why. You need to hear this. Taiwan did not just build universal healthcare, they built an AI stabilized healthcare ecosystem. 99 population coverage, AI driven fraud detection, automated hospital payments, smart health cards with full medical history. Listen to that. Real-time national dashboards, early detection algorithms, seamless senior care monitoring, 93% patient satisfaction. Meanwhile, life expectancy in Kenya is 67, Taiwan is 81. Kenya's infant mortality is 28 per 1,000 births, Taiwan is 4 per 1,000. Kenya's healthcare workers per 1,000 is 0.2%, Taiwan 3 to 5. Insurance means nothing if there's no doctor, no equipment, no working system behind the scenes. Is SHA better than NHIF? The honest truth on paper? Yes, absolutely. In practice, ask me again in 3 to 5 years. Here's what will determine SHA's success: whether Kenya adopts real AI tools, whether hospitals are paid on time, whether seniors get actual access, whether chronic disease is tracked digitally, whether corruption is detected early, whether the informal sector is integrated, whether the digital system stabilizes. If you're middle class, you are paying more. That's a fact. If you're in the informal sector, the mechanism is not clear, also a fact. If you're poor, subsidies should protect you, but Kenya's track record tells its own stories. I want SHA to succeed. Every Kenyan deserves quality healthcare, but we also deserve transparency, data integrity, and a system that can carry us into the future, especially our seniors, because if SHA fails, it will not be the rich who suffer. It will be the elderly, the caregivers, the families who already carry the heaviest of burdens. Now tell me, are you on SHA or still NHIF? Have you tried using SHA at a hospital? Are you paying more or less than before? Share your experience. Your story could help another family. If this video helped you understand SHA better, hit the like button so more Kenyans can see it. And if you want a full breakdown of the SHA benefit package, what's covered, what's not, and the loopholes they don't advertise, let me know.